But it's an interesting conversation because way back when, before the synthetics were around, this Synthroid, Cytomel, Leothyronine, levothyroxine, there was actually something called desiccated thyroid, which I like to say is the original organ meat. Dried pig porcine gland that was harvested from the mammals. 1890s is actually when that came on the block. So guess what? Yeah, it's not FDA approved, but you know why? Because in the 1890s, there was no FDA, essentially. But they've been around forever, and they were around first. And it's kind of creative because what's in that product is the full thyroid gland ingredients. So the best way to say that, it has T4, it has T3, it has T1 and even T2. And what's interesting about that is the T4 and the T3 are in a 4-to-1 ratio when it's given to you. So it's a little static. If you're doing desiccated thyroid, which is what this big group of the T4, T3 combos in a natural form comes from, you can also get it compounded from a pharmacy to specific ratios, but there's 2 or 3 main companies. You've heard of the brand names NP Thyroid, Armor Thyroid, Nature Thyroid. Those are the predominant sources of this T4, T3 combination. Now, it's true side note, when I was in hospitalist role, I remember I had an attending physician who actually said to me, because when people come in, they give you your medication list and you're like, what's that one? And I saw Armor Thyroid, for example, on it. And verbatim quote from the attending physician, who was about always 10 to 15 years my senior in authority and practice. They said to me, oh, it's just the antiquated thyroid med. We don't deal with those things. And we would actually take people off of their Armor and switch them to Synthroid while they were in their stay for the hospital community. I shake my head sometimes thinking back about that, because now knowing what I know and the differences in the behaviors of the 2 medications and the relevancy of them and having that instantaneous component of T3, I do wonder if outcomes could have been better for certain patients because we switched them off of one thing, placed them on another, and that can get tricky for the body. So things to kind of know on this Synthroid, Cytomel, NP, Nature, Thyroid, Armor, not controversy, but a little bit, because if you haven't heard in the news, the desiccated thyroids are kind of on the chopping block. And as practitioners, we have big concerns about that because this T4, T3 combination is very relevant to certain persons. But bringing this all back to, did you know you can take thyroid medication in the afternoon? Well, yes, you can if you're using the desiccated products or if you have like a Cytomel synthetic T3. Because of its half-life, that's the answer. When you wake up in the morning, you get that instantaneous T3. You take this on an empty stomach without food so the body well absorbs it, and it goes to work for you. It gives you that function of the thermogenics, your body temperature being raised up. It gives you the building blocks to be able to do the strong hair, skin, and nails. Brain fog, best game changer for that, for people who really struggle, and a whole host of other things. Even people who have eyebrow lateral thinning of the eyebrows, it can help restore that hair loss for them too. So we want the boost, we want the perk, we're up and out the door, right? Good things. But by 1 or 2 p.m., half of that's gone. And so sometimes people feel that slump. And so what the workaround is to give them a second dose. Could be lower, could be the same as the morning impact, but it will give you that 24-hour of T3 instead of just a straight linear slope decline. And that can be very advantageous for some people. So not for everybody. There are risks with thyroid medication, obviously, if you don't know them. Things like tachycardia, things like palpitations, things like having too hot of a body temperature and feeling hot flashy, diarrhea if we give you a little bit too much, bone loss if you use it incorrectly, and let's think, tremors or anxiety sometimes also can come from an incorrect dosing. But I thought people should know, because the afternoon dose, if you're using a desiccated product, has been quite a game changer for a lot of clients that I've seen. And I think that you need to have options for your lifestyle and also for your own physiology, because again, not everybody's the same cookie cutter case, and we have options out there that could really help improve your life and your quality.